All right, Saturday night, the 21st of September, 2024. Here we go. TikTok Live number 32. I'm going to go on as long as I can tonight. Let's do this. I'm going to shout out people as we go. If you ask a question, I say your name, and then I repeat your question, and then I'll go from there, okay? The longest viewers, whoever stays on the longest tonight, I'm going to be shouting out on the podcast in the captions, okay? There we go. Sports Talk TV is coming on. Hatha joined. Portia Pisano joined. Catherine Morris joined. What's going on? What's going on, friends? LOL joined. Elizabeth joined. What's up? Ali joined. Ali said, hey. Marky Andrews said, hi. What's up, friends? What's up? Luke Predental. Luke, you took Luke out of Luke Predental. It's only Predental now, man. Dude, you got to put that back on there. That's your name. That's your image. It's your brand. Little Birdie said, hello, my husband. I'm not married. Sports Talk TV. Brennan, what's good, bro? Prime Jordan versus Prime Kobe. Who wins in a 1v? I wish we could have seen that. Great question, though. Great question. Guys, ask question. I give you a shout out on the podcast. I'm recording this. I'm putting this up on YouTube, podcast, LinkedIn. I'll be posting this later on. Cut up the clips, put on YouTube and stuff. Whoever stays on the longest, the 3 people to stay on the longest, I put in the caption and shout you guys out later. All right. Let's keep going. Here we go. A little birdie said the only sexier thing than a man in scrubs is a man with scrubs. Man in scrubs with a goat farm. How do you come up with that? That's hilarious. Goat farm, but like the baby goats, right? They got to be like the tiny little goats that kind of like hop around, and when you scare them, their legs just stop, and then you know what I mean? Hey, little birdie, have you seen that? Oh God, could you imagine that? Wow, that's great. I'm gonna have to get a goat farm. Just walk around in scrubs playing with goats. I don't know. HSOL, what's up, man? I'm a D1. Love your content. What's up, man? Thanks for coming on. Appreciate the kind words. Sports Talk TV said, if you could have a beer with one athlete alive or gone, who would it be? Ooh. I mean, Michael Jordan's incredible. Kobe Bryant was also incredible. I can't believe Kobe's gone. I can't believe that. There are a lot of incredible athletes. I mean Arnold Schwarzenegger's amazing, but I don't know. I feel like Arnold's got to get out a little bit more now. I know he had a surgery, several months ago and whatnot, but like, I feel like he's got to get going again. Edith Masons shared the live. Thanks, Edith. What's up, guys? Let's ask questions. Did I miss any? Ask questions. I'm going to shout you out on the podcast. Let's go. Ask some questions. I'm going to shout out your name, and then I'm going to repeat the question, and then I answer it. Longest 3 listeners to stay on, put out onto the podcast when I post this. I'm recording, guys. I'm going to put this out later on all the channels. Mediocre Med said, which do you list first after your last name, MD or DMD? Well, I have neither. I have DDS. DDS is the same thing as DMD, basically, but depending upon which degree you get first, so I've told you put that one in front, okay? Some people prefer to, when they get their DDS or DMD before the MD, MD is a different degree, right? You know that? They like to put that first. I don't know. I don't know why. I don't know what goes first, nor will I ever have the opportunity to put one first or the other. I'm going to finish graduating in 9 months of oral surgery residency, and then I'm going to get out. I'm going to start working in private practice. I'm going to get some real life aspects in, and I'm probably not going to go for degrees or certifications after this. I know what I want to do every day. So Sports Talk TV was next. Kobe's death still gets me. 2-man tragic. I'd probably choose Ali. Oh, Muhammad Ali. Muhammad Ali's a good one. He was very, very talented. He knew how to market himself and brand. You know, he was a TV personality, if you know what I mean, right? Mason, I love your med talks. Thank you for the content. You got it, Edith. Thank you. I appreciate your kind words. Anna said, do you have to do research while in residency? Yeah, we do. Did a case review. It was a very short topic. I did it with a group of dental students at the school, which was excellent. They were a big help. We do. And yeah. Enigma, you look Mormon. Are you Mormon? I'm sure you're Mormon. I'm actually not Mormon, Enigma. Funny. Good try. User 12222, etc. I'm not sure I can go to my externship anymore, and I already have a few more scheduled, so I don't know if I can go there at all, but I really would love to go there. What would you do? I don't know. Delivery there is kind of throwing me off. I'm not sure if I can go to my externship anymore. Is that... Don't go. I mean, make sure you go to all the externships that you schedule that you want to go to, that you'd be excited to be at. I would go to as many externships as you can. If you have it scheduled, you could get off from dental school. Why wouldn't you go? You know what I mean? 10 said, how many times do you perform a surgery in a day or case report? Well, a case report is a study, like a publication or research. But you mean how many surgeries in a day or cases? I mean, it could be anywhere from, 4 on Friday, 1 at one institution at the hospital, and then 2 sedations at the dental school. We did that, and then we finished all that by, noon? After that, I went over to the other hospital, different from another third new one. I was never at this a different hospital, and I could have gone there for one last one, but it was just extractions of teeth, and they had a team of a chief and a senior, so I wasn't going to go into that. You know what I mean? That's like too much. So yeah, Mediocre Med said, you have an OMFS certification? No, not yet. In 9 months, I'll graduate from residency, and then I'll get the OMFS certification. Mediocre Med, gotcha. Mary Santana, what's up, everyone? What's up? What's up? By the way, 3 listeners that TikTok shows me stayed on the longest. I shout out on the podcast in the caption later on. Keep that in mind. Mary Santana, where are you planning to open up your practice at? Well, I'm not going to open up my practice. I don't think that is the right way to go, at least fresh out of a residency program. I think it's best to look into private practices, which I did. And I signed with a place called All County on Long Island. I'll be working in the Melville office starting October 15th next year. That's the plan. Teeth, titanium sedation. So taking out teeth, bone grafting, socket preservation, sinus lifts, get that bone, putting in implants, and then sedations. I'll be able to put patients to sleep. Okay, that's what I'm going to be doing. Luana I. List the most common complaints during your residency. Ooh, complaints. All right. Number 1 complaint is residents don't make enough money. They don't pay residents enough. They're literally working probably the amount of money that they pull into a hospital. Like, for example, in 2 weeks of being on trauma call every 3rd day, I would make more money than my salary in those 2 weeks' time, right? But we're paid a salary, so it's a fixed sum of money that comes in every 2 weeks, and you get X amount by the end of the year. So it doesn't matter if you work X amount of hours or not X amount of hours, you're going to get paid the same. And it's a great way for the hospital. They use it to exploit trainees who end up doing a bulk of the amount of tasks that happen in a hospital setting. And so I mean, if you average it out, it came out to about $7.50, between $7.50 and $8 my first year. The second year came out to just under $10. 3rd year was between $10 and $12, probably closer to $12. And now this year, maybe, I can't tell you for sure, I might be around $14 to $15 an hour if you average around, probably $15 an hour so far if you average out the amount get paid versus hours work. Yeah, so it's a very interesting setting. It really is. Ayo Buddy said, you still with your girl? Yes, I'm still with my girl. Malboy said, you skipped my question. Where's your question? I don't see it. I'm looking. Malboy, nope, I don't see it. Hamster82, you should look into TBIs. Why should I look into TBIs? Jeff, thoughts on denosumab and bisphosphonate and osteoradiant necrosis of the jaw? We just had an osteo case on Friday morning where we open it up, we debride the mantle, get all that dead bone out of there. We send it out to pathology to look at. We culture it as well, get a bunch of there. Then we clean it all out, clean all the bone out, scoop it out, the burr, drill it out, and then we put PRP in. PRP is protein-rich plasma, and then we put that into the wound, close it up, vicral sutures, chromic sutures, and then good to go. But thoughts on denosumab or bisphosphonates on it? I mean, both of them have shown they've been shown to be associated with osteoradiant necrosis of the jaw, right? Osteonecrosis of the jaw, that would be with radiotherapy, right? And radiation. But yeah, osteonecrosis of the jaw has been linked to both denosumab and bisphosphonates. Now, it's a very low rate, but as you increase in IV bisphosphonates, are more likely to be more associated than oral bisphosphonates, right? And then in addition to that, the longer you take that IV bisphosphonates, like 3 to 5 years, that increases your chance. And even at that, it's still a minimal number. Like it's less than 20%, less than 10%. And then on the other, like if it's less than 3 years, it's like less than 3%. So very low. Does happen, can happen. It's best to get those dental needs taken care of before you start therapy like that, right? And this is not medical advice, just throwing it out there to answer the question to the best of my knowledge and opinion. User 1222, my bad. So my free dates in the future, I already have others booked and confirmed. I'm going to go on six externships. Excellent. Keep those 6. Try and get at least 3 in. You're going to hit that. Get 5. You're good to go. User 7356, question. If you took out loans for dental and you go into OMFS, does the interest keep stacking? That's a great question. I'm not sure. I'm not sure about that. Do you have any trauma? What's it like? Yeah, we do. We do facial trauma. In fact, on second call this weekend, last night was facial trauma. Yeah, so we do that. What's it like? Well, fractures of the facial area, facial bones, upper, mid, and lower face, laceration repairs, stuff like that. I'm sure I'm missing something. ENT, first 2 months of dental school had slammed me with work. Where did you find time to study for the CBSE? Well, in a year or so, you're going to be able to manage that work a lot more. And it's going to be more work. I know it's a lot. It's definitely a lot, but you learn how to manage it better. You learn efficient and effective studying. Effective studying is getting higher grades, like 80, 90, 95, etc. Effective studying. Efficient study is now maintaining those A's while studying less. Okay, you get efficient, you get more repetitions in a short amount of time. That's it. For me, when I found that out, was Quizlet. Quizlet was the best, and oral path went really well because of Quizlet, honestly. In addition to a number of other subjects, Quizlet with the figures, that's the best way to go. But on top of that, I cut out exercise for a while, like just one day a week, just Sundays. I would also get up earlier and I would stay up later, and I would cut out distractions. So it was really not a good lifestyle. I would not recommend living this way and studying this way, but like I cut everything out. I would study at Panera because we didn't have like a lot. We didn't have like a true library to study at with our dental school. I would go over to Panera. I wouldn't even buy dinner. I would heat up my frozen dinners in the microwave at Panera in front of them, just like staring at the Panera employees behind the desk, like, yeah, I brought this meal. This is freshly pop it in the microwave. Yeah, and I would do upwards of 15. I would get between 10 and 15 hours on weekends, Saturday and Sunday. On weekdays, I would get up about 5:30. I would get an hour in a block in a View World, and then I'd go to class from 8 to 10, study the questions I got wrong in that block in the 8 to 10. Clinic 10 to 1. 1 to 2 was lunchtime. I go right back to reviewing the questions I got wrong in the morning block. The morning block was timed. Afternoon clinic 2 to 5. And then after 5 o'clock, immediately back to Panera, get right to Panera. Now finish reviewing what I didn't get to in the morning UWorld block. And then I would do another 2 blocks at night, just about 1 to 2 blocks at night. Weekends, the maximum I got was 5 blocks a day. That's when I was really cruising with gas. Anyway, you could do it too. I hope you love the analogies. I don't know. Let's have some fun with this. Get some fun questions. Let's go. Let's keep moving on. All right. I don't want to bore you to death. Let's keep it going. Let's keep it. Whoa. A lot of questions. Okay. These are 1, 2, 2, but Nova would be my number one. I don't know. I just would love to go, but I don't know if I can make it before applications. I don't know. It's up to you. Up to you, dude. Enigma. Favorite color of scribes. I think you mean scrubs. Black is great. So that my big sweaty pits in the middle of a, root tip pick of a premolar gets stuck in there and you're upside down doing yoga. I mean, I like probably lighter colors. I've been told that the lighter colors look better on me. It's probably because my pasty, white, pale skin, unfortunately. And I get made fun of. But what are you going to do? Pete, I have class 1 occlusal, but overjet. Ortho recommended extraction of 4 premolars. What alternatives? I mean, go with ortho. Do you want extractions or do you want jaw surgery? And that jaw surgery, you might not be a candidate for it. So I would listen to the orthodontist. You can always go to another orthodontist and get a second opinion, right? Mary Santana, awesome. Congratulations. Thanks, Mary. Well, we're not there yet. Got 9 months. Monka said work-life balance. Yeah, work-life balance is really tough. I mean, you got to make time. Sometimes on lighter rotations, you get more time to do more things, and I go all in. Other rotations, you really got to narrow down and just focus and unwind at the end of the day. That's when I'll watch shows. Right now, I kind of wind back on shows depending on time. Doing more podcasting now, more content. Because in 1 month, I'm not going to be able to do that anymore. I'm going to have a 2-month block that's heavy surgery, OR time, call every day of the week, call 2 weekends a month. Those 2 months are going to be a heavy block. Right now, it's lighter, so I do more content. I'm on a TikTok Live right now. By the way, TikTok Live number 32. And I will be shouting out the 3 people who stay on the podcast the longest. And I'm posting this to the podcast on YouTube and podcast on Spotify. All right, let's do it. Let's keep going. He said, or Audi, I don't know if you pronounce it like that, but Audi said, if you think you are badly paid, think about veterinary medicine, veterinary resident. We are badly paid. No, we're all badly paid, and we need to do something about that, guys. We need to band together, come together, and create a new system. Now, this is going to take a lot of time. This is going to take a lot of courage and years, as well as creativity to make a lasting system that works. Because I don't know if the existing system lasts more than 25 years from now. This is just the direction it's going in. It's been really going badly since the 90s and 2000s. 90s, 2000s were the golden years. Since then, it's been going over the hill. Ahmed, do you need to be top of your class to get matched to OMFS? Generally, that's what they say. You don't have to be. I know people that weren't and they matched finally, but generally they say, I mean, you need to be good. You have to have good standing as a student in dental school to get into oral maxillofacial surgery. 4621 would love to hear your thoughts on OMFS, who mainly does extractions, bone grafts, implants, etc., versus a super GP. But when you're an oral surgeon and, I don't know, I guess something goes wrong, there's a complication, you generally have more knowledge to do the right steps and stuff, right? A super GP is really bending the line, and a super GP is not trained on the complications. We see this all the time. Super GPs, periodontists, endodontists sending us complications that happened. An infection gets out of hand. Where do they go? They go to the emergency department. Who sees them in the emergency department? Oral surgery does. We do. Super GP fits right in that category. I would keep that in mind. Okay. So what are my thoughts? I think we really need to train dentists and do a better job at training dentists to stay within their scope of training. Do no harm to the patient means don't do something that you don't have adequate training in. We have certificates in oral surgery and other specialties for a reason. All right? That's just my thoughts. In addition to that, we need to band together. This is another thing. We need to come together as a profession in dentistry, and we need to start to give some pushback to these insurance companies. These insurance companies have not increased the reimbursement for treatment that's already been rendered to the patient to help the patient. Insurance companies deny paying for it. Dentists, doctors, they're doing free work left and right. It's these insurance companies that's the problem. They're the root cause of this problem, okay? We need to come together as a specialty, and if they're not going to increase the reimbursements for everyone, just the large organizations with 50 plus practices, if they're not going to increase the reimbursement for everyone, we need to create a new insurance plan. It's just that simple. We can do this if we come together as a whole. And by coming together now, it allows to keep this profession and industry very healthy going forward, puts patients back at the center of it. People keep saying, I just saw a video yesterday, they're talking about dentists are the biggest scam in America. That's ridiculous. Insurance is the biggest scam in America, especially now. How many times do you go to the doctor and they're not even like clearing your cleanings? She needs 2 knee replacements. She can't walk, and they're not going to clear the reimbursement for the surgery to clear that, accept the surgery until she's gone through PT, and PT says no. This woman needs to work every day on her feet. Maybe she's, an assistant in a dental office, right? Like, and you're not going to clear her health care. She needs this. Anyway, I could go on and on in this for days, but let's really focus at the root cause of these issues, okay? Don't hop and skip and jump and start pointing fingers at the doctors, okay? The doctors are held under the thumb. Number one, with loans, these institutions are bumping up the bill for what? The education hasn't changed. And then number two, these insurance companies, they are soaking the system and not reinvesting back into it, which means they're not investing at the end of the day into the patients that pay them. Their own clients, they are not giving back to. Anyway, I think you get it. Yeah, so what's going on, friends? Let's keep moving. I'm sorry about that. Sports Dog TV, most difficult procedure you've done so far, and you've had a case to deal with leukoplakia. Yeah, we had leukoplakia. In fact, there might be something this Friday that we're doing a resection with, but that's cancer. Here and there, we have less of that. And I don't know, I prefer like the dental velar. I like trauma. Trauma's fun. I want to do more of it this year. Yeah, so that's that. Most difficult procedure I've done so far. I mean, there's a lot out there. I mean, the most risky and invasive procedure we do in oral surgery within the dental realm is the Lefort, orthognathic surgery. Lefort osteotomies, BSSO, that's the bilateral sagittal split osteotomies. Those are difficult. I don't know what I would say is the most difficult procedure I've done just yet. I mean, fishing out roots out of the sinus is fun. I don't know. Moody, I know the OMFS scope is pretty wide, but what are the majority of the cases you would see? I mean, majority is teeth titanium implants in a residency program that's linked to a hospital. You're going to be taking care of a lot of infections and emergencies like that. We have a level 1 trauma center, so we see a lot of trauma of the face, the maxillofacial area. How common is Ludwig's angina after third molar extractions? It happens. Very uncommon, though. In fact, I would say very rare. Now, you'll see a lot of diagnoses and people throwing out around it's got Ludwig's. Like 9 out of 10 of them don't have Ludwig's. And then you get that one that is Ludwig's angina. And you got to be careful, therefore. But no, it is very rare. It is very rare, right? You're going to see Ludwig's angina in that patient and it's going to be super life-threatening. In the patient that is horribly overweight, like overweight, like they're very overweight, uncontrolled diabetes. They have diabetes and they don't take their medications, right? That kind of patient, they're immunocompromised in some other way, shape, or form. A very sedentary individual, maybe a short neck. Yeah, those are the patients that you're going to see with Ludwig's angina, right? To give you an example, Carter, what types of surgery do you do in OMFS? Extractions, implants, bone grafting, facial fractures, facial trauma. Orthognathic surgeries where you cut the jaws and you move them forward, up, down. You can rotate them, adjust the cant of the maxilla, for example, stuff like that. Okay, big stuff, a lot of fun stuff. Amanda, what should I be doing as a D1 to prepare for applying to oral surgery? As a D1, this is really early in the year. Right now, it's September, right? I would really focus on just understanding efficient and effective studying. Okay, I mentioned this before, and I'll get into how I found this. Effective studying is getting higher grades, right? Very straightforward. That's the first thing. You need to get higher grades. 85, 90, 95. And then efficient studying. Effective is increasing grades, and then efficient studying is maintaining those A's, but studying less and less for that subject. Got it? Why is that important? How did I do it? I did it with Quizlet using the premium version where you can put figures on it. Why is that important? Because later on, you're going to be studying for the CBSE if you want to get into oral surgery, and you're going to be doing it on top of classes, clinic, and you need to study for that CBSE. The CBSE is the hardest test you're going to take in dental school if you want to go into oral surgery, right? In order to study for that, you're going to need to be able to have the most impeccable time management skills. So first, worry about studying. They're going to add in clinic into dental school later on, all right? You need to be able to do both of that, handle it just fine, do well. You need to excel because you need to be in good standing in your class, right? And then after that, CBSE on top of that, okay? Good luck. You got me if you need anything, okay? Oh, every time I hit flick up, it adds like another 20. Q, are you a dentist? Yes, I'm a dentist in oral maxillofacial surgery training. Here we go. I found it. Yes, KLL said yes, interest always continues to accrue. There you go. That's not good. So KLL was answering the question of when you have loans, when you start oral surgery residency, does the interest continue to accrue? I didn't know this, but KLL said yes, it does. That's important to know. I didn't know that. User 7356, you didn't take out any loans. That's impressive. Well, it's impressive. It's also, I don't have any siblings, unfortunately. There were some issues with that, but when parents, whatever. But I always want to have siblings. I would say now, always the grass is greener on the other side, right? I would say I would rather have siblings and loans rather than no siblings and no loans. That's what I would say. I would go out on a limb. I would rather have a bigger family than it be just me. Then my parents got divorced, and then it's like, wow, this is really tough, But yeah. So is it impressive? I don't know. I'm very grateful and fortunate that my parents worked hard enough to do that. And then again, I also benefited from the unfortunate fact that I don't have siblings. Oh, I don't know about impressive. It's impressive on my parents, not impressive on me. And so, Sarah, it's exactly what they do at Panera. That's funny, Sarah. That's really funny. T-Quatch, I'm about to graduate hygiene school this year, and I am interested in dental school. Do it, yeah. JFCJD, hey doc, when did you receive your interview invite to Stony Brook? It was in late October. It was late October. Yeah, that's when it was. Tharva Kudramodi. When should I take the CBSE if I'm interested in a 3-year program? What? What do you mean a 3-year program? There are no 3-year programs in oral surgery. Just clarify for me. Calorcam, do OMFS residency, appreciate more experience as a general dentist or specific research? I'm not sure. And I'm not sure that there's a really good comparison between that. Maybe, I don't know. Because then you could also say certain programs are very big into research and then certain programs are very into work. Those program directors that have backgrounds in research or hard, just in the OR work, just working all the time, they're going to be more inclined to look at different candidates differently, right? So that's a subjective question I can't give you the best answer to, unfortunately. Manny, hey, Brandon, I'm overwhelmed with exams. Any advice? It was a lazy day for me for studying. Oh, I hear you, Manny. I hear you. Yes, my advice would be take the rest of the night off, probably. I think that's a good idea. Get some good sleep, though. Don't wake up too late. Maybe don't wake up too early, but get on it tomorrow. Get a nice fat cup of coffee, a large, grande, muy grande. Just get to it tomorrow. I would kind of mitigate the anxiety that might come tomorrow because you only have one day now to do all the studying and stuff. I would try and mitigate that by using the app To Do. That's what I use literally every day. It's an app. It's a free app by Microsoft that synchronizes across devices. And that's what I would do. Excuse me. I just ate dinner before I hopped on. And that's what I would do, okay? I would organize all your priorities into one. You could use it as a calendar. You could use it as a to-do list, a scheduler, and you can even organize different classes and clinic stuff into folders on the app. Within that app, just knock off things one on one. So it's a to-do list. Just knock them off and just get to it. You got it? Egan said, please give us TMJ sufferers some love. Well, I'm sorry you suffer from TMJ. I'm sorry about that. What kind of love do you need? Any advice? Yeah, so that would be my advice on a lazy day. I would also recognize when you're being lazy. Recognize when your mind is kind of derailed from the track a little bit. Get back on top of it by getting a workout in. Maybe go into some planks, do an ab workout, go for a run, stuff like that. That's my biggest thing, right? That's how you're going to kind of clear your mind, get a nice reset, and get back to it. Exercise is the key in that sense. Emily, are soft bristle toothbrushes better for you? Yes, you want soft bristle toothbrushes because hard bristle toothbrushes can cause gingival recession. They're very abrasive. They're going to push down those gums over time. It could cause, and then when they push it down, that exposes the cementum of the roots, right? It's going to expose those roots, cause some extreme sensitivity over time as well, potentially. Aren't you Owen Hunt? Mohammed, what if your school doesn't have internal rankings? How do they decide who's good for the residency? Well, great question. Stony Brook was just like that. We had grades, but no ranking. We took the CBSE though, and we matched 4 for 4 in my year to oral surgery. It went well. Muhammad, is it just CDSE? It's CBSE, and that is the admissions test that they use basically for oral surgery residency. Ricky Baker, what kind of emergencies are we talking about? Emergencies generally are, airway compromise. That's an emergency. Sometimes you see that with like Ludwig's angina, like I was saying before. Sometimes you see airway compromise with large infections like that. You can even see it with mandible fractures if, like the muscle attachments to the mandible, if it's a bilateral mandible fracture and in the back somehow, and everything's pulling the lower jaw backwards. I mean, that's a very rare scenario, but I mean, technically, I guess it could happen. Pathology, you might see that with that. Those are some emergencies, right? Megan, talk that talk. I had to pay $2,000 for a dental appliance so I could stop my jaw from locking. Oh, I'm sorry to hear that, Megan. And yeah, like we need to get dental insurance, any insurance company to start covering things again, right? This is healthcare. This isn't like you're ordering something on Amazon. You're getting surgery. If it's elective, that's one thing. But if it's surgery that's necessary, we created insurance to allow people that need that treatment to get done. And now they get that treatment done. Doctors do it, and they're not reimbursing it. And if we can't fight back against this and allow healthcare to get back where it needs to be, then we just need to create a new insurance program. It's just that simple, right? Here we go. Handshake said, been following for a while. Just finished my DAT this summer, thankfully. Thanks for the motivation. Yeah, man, you got it. Ricky Baker, what kind of symptoms are there for an infection? Oh, well, I mean, pain is going to possibly swelling. I mean, you could even have changes in vital signs. You could be febrile. You could be tachycardic. That's an increase in heart rate. You could have high blood pressure. There's a number of things. You could experience you might have drainage of the infection in the mouth. Halitosis is bad breath. You could have drainage of the mouth of purulent drainage, right? Pus coming out of wherever that infection is. You could have difficulty tolerating secretions. You might be salivating a lot if it's a big infection and your mouth is just trying to deal with it by increasing secretions, and that can become difficult. Difficulty breathing, changes in your voice, the phonation of your voice. For example, if you have an infection in the floor of your mouth and it raises the tongue, that's going to change, pushes backwards, so that's going to change your voice. It's going to change the pitch as you phonate, among a number of other things. Luna Bug 819, Doc, my thing is inverted. Does that make me a girl? What? I'm a dentist. Amanda, thank you. Welcome. Green something said, what were stats for dental school application? Got an average of a 3.6. I think it was a 3.64. No, 3.6 in undergrad. That was my GPA from NYU Polytechnic School of Engineering. It's NYU Tana now. It's the Engineering School of NYU. I did 2 years there. Got a 3.4, and then I transferred to Stevens Institute of Technology in Hoboken, and I got a 3.8 there, so it averaged to a 3.6. I did like 150 shadowing hours. I worked at an oral surgeon's office. I shadowed the oral surgeon and multiple general dentists. I got a 21 academic average on the DAT. I got a 22 on the PAT, and that's everything right there. What else can I help with? 8-1. Hi, Doc. What's up, Red Sparrow? Thanks for coming on. I got you on a Saturday night. All right, sweet. There's a lot of people. Wow, 1.5 thousand likes. Sweet. Thanks, guys. Watch this later on YouTube and podcast. I'll be posting it there. The top 3 listeners that stayed on the longest will be shown to me in the receipt of the episode, like the record of the episode on TikTok. I'm going to put you guys, I'm going to give you a shout out in the post that I'll put up on YouTube and podcast. All right, let's get to the next one. We got AB123, just finished block 1 of gross anatomy. Nice. That was in my top 3 favorite courses in dental school in D1. 100%. I loved anatomy. It was awesome. Baker, to be a general dentist, how hard is it? Oh, it's difficult. It's definitely difficult. Dental school is no joke. Now, undergrad have what the most I took was 21 credits. I don't know. What is the average, like 15 to 18? I took 15, I took 18, I did 21. In dental school, they say it's the equivalent of taking 32 credits a semester. Okay, so dental school is a lot. Keep that in mind. Tyler, can orthodontists pull teeth? Well, can they? Yeah. Do they? I don't know of any orthodontists that remove teeth. Back on TikTok, Grind asked, how do you know about ranking while maximizing your chances of being matched? I get it, and I think you're overthinking it a little bit. Rank your schools based on where you're most interested in going, where you see yourself going, where you'd be most excited to wake up every single day for 4 to 6 years and still be ready to go. You know what I mean? That's the order you want to rank your. Use your intuition. Go by your gut feeling. JLo 293. Is CBSE hard? Yeah, CBSE is hard. CBSE is one of the hardest exams I've ever taken for me personally, right? And I didn't go to med school. I went to dental school. I'm not in the MD track, the 6-year track of oral surgery. I'm just in the 4-year. I don't get my MD. I don't take any med school classes now. Thank God. Humana.org or bone grafts required for wisdom tooth removal? No. Very rarely do. Never. I don't know of any instance where you'll bone graft after removing a wisdom tooth. Let's eat one. Insurance is terrible. Yeah, it is. I don't know how we got to this point in 2024, going on 2025. Adama said, how did you know you wanted to do dentistry? Well, I mean, it's cliche. I wanted to work with my hands. I wanted to work with people. I felt that was fun. That would be fun. And I mean, it is. People say doctors are generally well respected. We're at an all-time low for patient trust in providers, and doctors are not generally well respected as they used to be in the 70s prior to that. And today it's a completely different day. So I don't know. Yeah, but why I went to it? Because I thought that being a dentist and now being an oral surgeon would be a great way to be in a nice small business, maybe family run one day. I think that would be pretty awesome around patient care, not just selling toys or like selling Amazon products, working with people. And I have a dream to do that, to be part of a multi-practice and to build that multi-practice, create something that's better than what's out there, something new. And hopefully between a lot of different ideas I have, the insurance being one of them, a new practice model being one of them, among others, we can, this profession is going in an interesting direction. And I like to see it go in a bright one, a better one, a great one. It'll be great. So, all right, let's keep moving on. Red Spow 0581, you're doing terrific, Doc. Keep up the good work. Thank you, Red Spow. That's very kind of you. Eli said your Gorilla Glue video is gold. Got to do some fun stuff on the side like that once in a while, right? Gorilla Glue, eh? Oh, my God. All right. Babe 123, any advice for getting better with hand skills while using a handpiece? Just practice. Just practice. Growing up, I played the violin, and then I played basketball, high school, college, thousands of hours of dribbling and working on hand skills, literally to shoot the ball and dribble it skillfully. And I think that translated very well into dentistry and my hand skills here. Now, very confident with that. Yeah, so it's really just practice. It's repetition, right? Fatima, 31 credits is insane. Yeah, 32 credits, actually, they say in dental school. Guys, keep asking questions. Let's go. 17. Okay, we got to get going soon. Do you know Dr. Abramson from Stony Brook Dental? Absolutely. Dr. Abramson and I were boys. Dr. Abramson is awesome. Please let him know that I said hello if you can. Please. Shout out to Dr. Abramson. He was awesome. He was one of the great faculty we had at Stony Brook Dental School clinics. Yeah. Oh, way. Dude, that's your father? Wait, that's awesome. Love Dr. Abramson. Yeah, we used to talk all the time. Oh, yeah, he was a direct faculty of mine when I was at Stony Brook 4 years ago now. 4 years ago. Wow, that's awesome. Please let him know I said hello. And then I miss him dearly. I miss good people like that. That's great. That's awesome. Evan Real said so much med school stuff to do in the 6-year program. People have to do and when. How much med school stuff the 6-year program have to do? Yeah, they got to do a lot of 6-year program. Actually, if you do the math, it's somewhere between, it's like 4 months less doing oral surgery the 6 years. So they're in residency for 6 years, but 2 of those years they're in med school, give or take, right? And it comes out to an oral surgery service, doing oral surgery, they're actually getting about 4 months less, at least at our program. They're getting 4 months less of actual oral surgery, surprisingly enough. Isn't that interesting? User 1471 asks, favorite tool for extractions? Well, they're not tools, they're instruments, as you know, right? Well, it depends. If we're getting on a root, I love to get the spade. The spade is like, rather than going to the drill, I'd like to try the spade first, just to, because the drill can be traumatic to patients in the dental chair, right? So I usually go to the spade first. However, I'm really starting to like the crane pick. That's another elevator. And I like the crane pick a lot. Zachary Todd said, Mabe123 said, hope he didn't give you too much trouble. No trouble at all. No, I love Dr. Abramson. No trouble at all. We got along really well. And he was a great teacher too. Zachary Todd said, what's the best flap to lay if you are removing mandibular lingual tori? I mean, you got to do a sulcular incision, and then it's a full thickness. What do you mean? What's the best flap to lay? It's a full thickness flap. Well, you're going to do a partial thickness flap. You'll never get to the bone, right? That means you're leaving periosteum on. I mean, is that a question you're asking? Bios Creations. Hey, man. I think you did a typo. Thailand, follow the creator. Thanks, Thailand. There we go. Bios Creations. I remember calling you to discharge one of my patients, and you came up quick. Thanks, man. Awesome. Dude, yeah, of course. Discharge one of your patients. I wonder where. That also depends on how busy call is that day. You know what I mean? Yeah, of course. I try and get there fast as I can when I can, which, honestly, that's a lucky situation. Many times it's not so easy to get placed quickly in a hospital. There's constant, right? Like right now on Friday, I was at 3 out of the 4 institutions we cover. It gets very nuts, but yeah, lots of nuts. 1471. Sorry, I meant instruments, current dental school applicant, LOL. Yeah, it's all good. It's all good. C. Parker DMD joined. What's up, friends? All right. It's getting late. I think I'll cut it right now. Last one. Bios, creations. Well, you guys were discharging them, LOL. It was at the public school hospital. And I appreciate you keeping that on the wraps there. Gotcha. Yeah. It gets so busy there, by the way. But as you know, I don't have to tell you, everyone in that hospital is overworked and underpaid. You know what I'm talking about. Yeah, there was, and they want you to work overtime. But yeah, if we were discharging, I hope I would get up there quickly. Nothing was going on. Zachary Todd, do you ever use buccal fat pad to cover up an AO, oral antral? That's what that stands for. Communication. Yes, we can do that sometimes. I mean, that's going to be a really bad oral antral communication, very large one. Also with bone resorption, maybe the tuberosity was chipped off or more, right? And that's got to, like, other measures would have had to fail up until that. Well, not necessarily. If it's really bad, you could do it, but you don't necessarily need to do that. Over 6 millimeters, maybe even more. That sounds about right, though. 6 millimeters, that's getting towards a larger oral antral communication size. All right, friends, I'm going to pack it up. The top 3 the longest listeners on this pod. This is podcast TikTok Live number 32. I'll be putting this out on YouTube channel and YouTube, and I'll be shouting out the top 3 listeners that listen to this episode the longest. All right, friends, wishing you a good night. Thanks for coming on. And I'll try and get on. I don't know about tomorrow. I'm going to try for tomorrow night for TikTok 33. Try for next weekend. We'll see how it goes. All right, friends. Bios creations, last question. What I don't understand is, do all DDS refer to themselves as dentists? Yes and no. It depends on a lot of things. It depends on, do they have other degrees? Do they have a PhD first? I know a guy who has a PhD first, and, well, he still calls himself a dentist. Now he calls himself an oral surgeon. Oral surgeons, they like to call themselves oral surgeons. Periodontists like to call themselves gum surgeons. I don't know. Well, food for thought. All right, friends. Live number 32. Checking out now. 2.1 thousand likes. Thank you, guys. I love you. Thanks for coming on. Check this out on YouTube and podcast. I'm putting out the top 3 longest listeners on there. Give me a shout out. And we'll touch base soon. All right, guys.